Welcome everyone to the great webinar that we're going to have today, Travel Safe and Travel Smart. We are excited to have two guests with us today, but let me start by saying I'm Kathy Olewski. I'm the webinar host for the Vasculitis Foundation. I'm also a patient living with vasculitis, so we'll have some great conversations today. And I'd like to introduce first our two guests. We have Dr. Kevin Byram with us today. He's the director at Vanderbilt Vanderbilt Vasculitis Clinic, and he's an assistant professor of medicine in the Division of Rheumatology at Vanderbilt University School of Medicine in Nashville, Tennessee. So welcome, Dr. Byram. I know we've had you before, but we're happy to see you today. And we also have Victor James with us today. So Victor is our guest patient, who is also a Vasculitis Foundation board member. He was diagnosed with GPA in 2012 after an emergency tracheotomy. And he lives in Stafford, Virginia, where he's lived for 61 years, and his family has actually lived there for generations. He was an Allstate agent from 1982 to 2018 until he retired on medical disability. And his first experience with the Vasculitis Foundation was at a symposium in Philadelphia in 2013. And he just thought that was an amazing experience. So we're glad to know that was your first exposure to it, and that you, as a result, became a patient of Dr. Merkel's in Philadelphia, and you still travel 200 miles to see Dr. Merkel every time you need a checkup. And we're happy that you've been in remission since 2013 with only one flare. So welcome to you also, Victor. We're happy to have you here today. And I don't want to waste any time. I want to let Dr. Byram take the lead and tell us what we need to know. There's so many questions that have come in through our patient social media sites and portals. We're just happy to have this information for all of you. And so I'll turn it over to you, Dr. Byram.
Of course. I want to thank the Vasculitis Foundation for having me. Thank you, Kathy, for the introduction. Today's webinar I'll present shortly just some kind of tips about how to approach an upcoming trip as the pandemic has progressed and where we stand now. The world has opened up a little bit and travel has become a little more accessible. And so we're going to talk about that. We're also going to have some patient perspectives and some question and answer. So on to it. I think the guiding principle that you might hear us mention a lot is that the patient and their care team really need to assess the individual patient's risk. We are recording this on, the producers might be upset with me saying the date, April 20th. It's a day after federal judge struck down a mass transit masking mandate. And regardless of where one falls on the politics of such, I think our patients on immunosuppressives and with systemic autoimmune disease and specifically systemic vasculitis, it is impactful. And I think we're at a point in the pandemic where we can't really rely on an external. We can advocate for these agencies to help our patients, but I don't think we can rely on them. And so to protect our patients in every case. And so much of the risk needs to be decided upon by the individual patient and their care team. And so that is the approach I'm taking here. So I think prior to traveling, you of course need to talk with your provider. Now we're going to have some like patient level considerations. I've seen some of the advice given, and it's wonderful advice that's kind of more into the minutia of how you might prepare for a trip. So this is more higher level, but I think you need to ask your doctor if the second COVID-19 booster is right for you. To be considered fully boosted, it needs to be administered 14 days prior to departure of a trip. Most patients, I think the answer for most patients is going to be yes, that this is the right thing to do. I think the other thing you can do is to get your family vaccinated. Whomever is traveling with you, there was an early paper, editorial style paper written in the New England Journal, one of our big journals, early in the pandemic. And this is one of the best ways you can protect yourself. But for the people that you're going to be around the most, having them also be vaccinated. And they should talk with their providers and see if boosting is the right thing to do for them. We have gotten a lot of questions about Evusheld, which is a long-acting anti-COVID antibody infusion. And if you're eligible, I do think you should talk with your provider and consider whether that is feasible and indicated. Many patients on B-cell depleting therapy like rituximab or biosimilar agents to rituximab will be eligible for this, and I do think it's a good idea. I think it's really important, of course, for you to make sure you have enough medicine with you. If it's going to be a prolonged trip of any sort, making sure you have double the amount of medicine you think, just in case you have a layover or miss a flight, et cetera. You don't want to be shortchanged on your medicine. And then I think the other thing to consider before you leave in this digital world of ours is to make sure your patient portal login works. That perhaps you might have spotty connection with Wi-Fi or cellular service. And this might be one of the better ways that once you do get connected, that you can send a message to your provider's office and get an answer. Factors to consider when you are talking with your provider about whether or not you should even travel, or or factors to help mitigate any kind of infectious risk, is to consider your level of immunosuppression. I mean, even before the pandemic, those patients that were at the highest infectious risk, I would recommend for them to postpone travel. So these are patients on very high doses of prednisone, 50, 60 milligrams a day, or some equivalent. Those that are undergoing induction therapy with either cyclophosphamide or rituximab. So that means you're within the first few months of your diagnosis with systemic vasculitis and you're being treated with these agents or these high doses of prednisone. This is a really important time for the patient's disease to get under control. And it's in cases like this, I've had to unfortunately recommend that some patients not do a trip they had been looking forward to. That is a very difficult conversation to have, but it's always in the best interest of the patient that I'm having those conversations. So ultimately, I am not recommending that for the patients watching this. I think you need to have that conversation with your provider. If they think you are stable enough to travel and the medication regimen is okay for your travel, of course, follow their recommendations. And if there's a lot of variability here, there are some trips that are more important than others. So I think factoring all that in as well. The other thing I would empower patients to talk with their providers about is if you have a history of frequent infections, and of course, if you're on rituximab with that, then I think you should talk to your provider and see if they want to check a total IgG level. The other name for this is a total immunoglobulin G level. In patients with really low levels, you might be a candidate for replacement IV immunoglobulin, which can help with infectious risk. So patients that have been on rituximab for a long time, this is an option if you have very depleted IgG levels. And sometimes in cases where I've used this, this is one of the best interventions for the patient. They have infrequent infections. We get them on IVIG and they stop having infections. So really talk with your provider about that and see if that is feasible and indicated. While prior to traveling, of course, this is less relevant now, but if you're leaving the country, just become familiar with any pre-travel COVID testing protocols, either going to the destination or coming back to, many places are not requiring any kind of COVID testing now. Islands still might. So if you're traveling to an island, they very well might. And I think just become familiar. If the answer is no testing required, then that's the answer. But I think understanding if you need testing within the day or two before leaving, either to the destination or coming back, is important and can decrease a lot of stress while you're on the trip. While traveling, protect yourself. Wear a mask in an airport or taxi. Or on the plane. And I would also encourage your entourage to wear a mask as well. We can talk more about this in the context of the federal ruling in a minute. I would recommend wearing a mask indoors if you're on immunosuppression, particularly if you're going to be in and amongst a lot of folks and a lot of patients. A lot of other travelers. I would, it's the little things I think here that really loom large. Carry pocket hand sanitizer, carry the wipes, clean your environment. We've all become pros at this in the context of the last 2 years. I read an interesting study a couple of years ago, even before the pandemic, about having the airplane fan on just a little bit to help circulate and get fresh air. I think that would be a good idea. You don't want kind of stale air sitting next to you. Hydrate. It's really important to hydrate on a plane. It's very easy while traveling to get a little dehydrated, and it's in contexts like that folks with a pre-existing kidney disease, like our patients with some systemic vasculitis, can irritate the kidneys a little bit. But planes are also a risk factor for leg clots. Most people do fine, but patients with vasculitis have been shown to have a little bit of an increased risk of clotting. And so hydrating and getting up every few hours on a long flight just to stretch your legs can be really helpful. So I suggest if the flight's over 2 hours, to get up at that 2 hour mark, move around a little bit, and stretch those leg muscles. Lastly, if you are feeling ill, I think it's probably reasonable. The testing, of course, is in a much better place than it was several years ago. At-home testing is a thing now. And I think carrying a few COVID test kits with you is probably a reasonable thing. And if you become ill, to go ahead and test, understanding that if you test too early, if you test within a day or two, sometimes the test can still be normal or negative. So that's why I say take a couple, and if you decide to test, then you need to test, and then the next day you need to test as well, just to increase the sensitivity of that testing. The issue here is that early identification of COVID is key. The treatments work more effectively the earlier you get them in the course. Medications like Paxlovid, and then there are various monoclonal antibody infusions that really are only indicated within the first 5 or 7 days of having COVID. So test early, communicate with your provider if you have symptoms or a positive test, and then the plan comes into play of trying to get you these medications. That sometimes can be, of course, a challenge when traveling, but I think starting this process and getting that communication going, understanding that it might take a day or two to get some of these medications is important. The CDC has a great website and has travel tips of their own. Vasculitis.org here, of course, is important as well.
Okay, thanks so much, Dr. Byram. We appreciate that. And I think we're going to pop in a slide here, if you'll give me just a second. Oh, there it is. Good. And we got some medical travel tips in addition to Dr. Byram. Not that we needed any, because he just gave me some great things to think about. But I'm just going to cover a couple of these. But if we put this up here for everybody to look at, give you a few more things to think about. Maybe number one, talk to your doctor before you leave on a trip, just as Dr. Byram said. Ask your doctors for specific cautions, concerns, medical advice. And also, I thought I'd highlight avoid medication changes just prior to travel. One doctor said, example, lowering steroids or starting new medication. I want my patients to be on stable treatment where they've been doing well while they are traveling, and adjust medications if needed only after they return. I thought that was an interesting tip. And also, make sure you don't need any blood tests or other critical lab tests if you will be gone for several weeks. Carry your meds on board with you. And just one of the best things Dr. Byram said for me today, because I'm planning for a trip to leave in 2 days, was get extra medication. And maybe Victor will echo that, I'm not sure, but I do not have extra medication, and you could get stuck somewhere with a cancellation of a flight or somebody in your party getting COVID.